I utilized the same technical platform on urine extract to evaluate the THL's anti-cancer effect. The result was very surprisingly amazing. We cultivated cancer cells on the dish for a while and used a sharp tool to scrape a mark to observe this cancer cell's crawling speed into the scraped space. You can see that without THL, the scraped space 20 hours later in the middle was filled. This means that cancer cells crawled over and almost filled up the space. If THL was processed, you can see on the experimented dish, the gap among cancer cells appeared larger. This means that the crawling speed of cancer cell to fill up the scraped space was slower, and the ability was weakened. This is to tell you that THL can inhibit the migration of cancer cells. We got to know more about tumor stem cell. It could be the normal stem cell. Gene mutation might be the cause. Stem cell can be self-renewal and clonogenetic. It might cause cancer in animals and differentiate into other non-stem cells. Most importantly, it is drug resistant. Looking at this cervical cancer cell at the dilution of 0.1 to 0.4, THL appeared to have an obvious cancer inhibition. Therefore, we can calculate that at 0.2 diluted THL, it can inhibit half of cancer cells. Stem cell, in fact, can be eradicated by THL. The more THL used, the more effective. Chemotherapy indeed cannot eradicate cancer stem-like cell. We discovered that side population cell was more drug-resistant than non-side population cell, but side population cell showed sensitive to THL. Thus, the inhibition of cancer stem-like cell colony was activated, and the drug resistance effect was reversed. Recently, I integrated immune therapy with THL. Under the care of this integrated treatment, restoration of many patients' health was observed. I was very impressed by an ovarian cancer patient who was at the 3rd stage of cancer and survived for 15 years. We provided THL to him during this period of time as a supplement. Before his treatment started and between the treatments, beside examining white blood cell and red blood cell, we also examined and evaluated the activity of T lymphocyte, which was an indication of the patient's immunity system and how immunity performed. For the past 3 months, we examined 100 patients. The examination was scheduled for 3 phases. The trial should be finished by the end of this month. As far as I could see on the report, I would like to congratulate you. The results showed very effective on increasing the activity of T lymphocyte. When the trial finishes by the end of this month, we expect to conclude a scientific report for your future reference. In addition to the mechanisms of anti-cancer and immunity, we will focus on the subject of anti-angiogenesis, which is the innovative area of cancer treatment. We know about the growth of cancer. Because of the angiogenesis, cancer could grow very quickly. Thus, many anti-cancer drugs were designed to be directed against not on cancer itself, but on vessels, so-called anti-angiogenesis drug. This is a very new innovative field. According to our data, we primarily estimated that THL could affect on angiogenesis. Professor Wong's lab and our lab could work on the laboratory analysis, focusing on angiogenesis. I think this field is worth carrying on. This is one vision in the future. The radiation and chemotherapy that we currently use aim to kill those already developed cells which could be seen. But for those metastatic cells or the tumor stem cells, our treatment could not be effective. Thus, integrating THL into our treatment for effective inhibition could be the future complementary and alternative therapy, and an important theoretical foundation of cancer treatment. We hope that the result could inhibit cancer cells and activate the growth of immune cells. This could be repeatedly analyzed in our animal experiments. We hope to see, in 1 or 2 years, such investigation on the clinical trial. If our deed could help many cancer patients in the world by improving their quality of life or by helping them survive, this is what we want.
Cancer is a common disease. Even though you was diagnosed with cancer or your family have cancer, don't disappoint it or don't be panicked. You better select the best treatment, optimization of such treatment, integration of different modality of treatment, such as the modern medicine, or if you prefer the complementary alternative medicine, go to the specialist to identify such treatment.
I believe that patients have many worries. We are entering into the cancer treatable era. Based on the new cancer treatment development and the driving of integrative medicine, cancer becomes treatable. Regardless of the stage of their cancer, patients will ultimately be cured. Therefore, never give up hope. Please keep up with high energy. When diagnosed with cancer, don't be disappointed. There are many treatments in the world. Don't give up hope. Among all the treatments, find out the one that is most suitable. The most important thing is moving on. Because of the advancement of medicine, many new cancer treatments, including complementary and alternative medicine, have been integrated into the conventional treatment. Therefore, cancer treatment is promising in the future. Any cancer patients and their families should not be discouraged. Follow the direction of your doctor from your medical center and procedures of the treatment with consideration of CAM. Curing cancer, indeed, is full of hope.